Hi everyone, my name is Hilary Campbell. I'm a registered nurse, and some of you may have heard one of my other presentations that I did for the Change program that was on antihypertensive medications. And so this presentation is on cholesterol and drugs that are used to treat high cholesterol. So, what is cholesterol? Well, it's not all bad. Cholesterol is essential in the body, but too much of the wrong type is a risk factor for cardiovascular disease. And I do have a little video here by the American Heart Association. It's about 3 minutes long, and it does a really good job of describing the different types of lipids that are found in the body and what they do.
Cholesterol. It's essential to your well-being. But what do you really know about it? Let's start with the basics. What exactly is cholesterol? Well, it's a waxy, fat-like substance that's made in your liver and travels throughout your bloodstream. It's a key ingredient that your body needs to make new cells. But too much cholesterol can lead to serious problems, such as heart disease and stroke. Here's why. You see, there are actually two main types of cholesterol, LDL and HDL. LDL, or low-density lipoprotein, is sometimes called bad cholesterol because it can build up inside your arteries, which causes them to narrow, which can lead to heart disease or stroke. That's why you should try to keep your LDL low. Think of it this way, the L in LDL is for lower or lousy. On the other hand, HDL, or high-density lipoprotein, is the good kind of cholesterol. It carries LDL, the bad stuff, away from your arteries and back to your liver, where it's broken down and processed by your body. That's why you want your HDL to be higher. In this case, the H in HDL is for higher or healthy. There's actually a third component known as triglycerides, which plays a role in your cholesterol health. Triglycerides are the most common type of fat in your body, and their job is to store excess fat from your diet. Elevated triglycerides, along with low HDL and high LDL, can also increase your risk for cardiovascular disease, so it's important to keep your triglyceride levels low. For anyone who's had their cholesterol checked, it's only natural to focus on your cholesterol score, or the actual numbers. But the numbers don't really tell the whole story about your health. That's why it's important to discuss all of your risk factors with your healthcare provider, including risk factors that you can change, like eating a healthy diet, getting plenty of physical activity, and quitting smoking.
So I will leave it at that. And just to review what was in the video, we talked about LDL, your low-density lipoprotein, triglycerides, and then HDL, high-density lipoproteins. So LDL is, we call it lousy to help remember that the LDL is kind of the bad cholesterol. So it brings cholesterol, or it goes to the blood vessels and deposits itself there in the form of plaques. And these plaques lead to narrowing of the blood vessels, and this condition is known as atherosclerosis. And this is what contributes to heart disease, risk factors for heart attack and stroke. So it's good to have a low number for LDL. Triglycerides, so as mentioned in the video, excess calories in our diet are stored as triglycerides, so it's energy that we can access later when we need it. But when you have an excess, so your energy that you're not going to be using right away, too much of that is stored as triglycerides. And so you want to have a lower number as well, as high levels of triglycerides also contribute to cardiovascular disease. And then HDL, we think of happy when we think of HDL, because this is the lipoprotein that helps remove the LDL, or the bad cholesterol, from the vessels. It transports it to the liver, where it can then be removed. And so it's good to have a high number for your HDL. So what makes our levels higher or lower? And I just threw some numbers up here from our, heart and stroke guidelines. So LDL goal is less than 2. And some things that raise our LDL levels um, are diets that are high in saturated and trans fats, so our processed foods, lack of exercise, having high blood pressure, smoking, and then there are some hereditary conditions, so things that are passed down through families that make some people at a higher risk for elevated LDL levels. And so, what we can do to lower our LDL is modifying kind of the above risk factors that I had mentioned. So, quitting smoking, exercising, modifying diet, and then medications, of course, when we need them. Triglycerides are elevated by diets that are high in simple carbohydrates, so simple sugars. So things like sugary snacks, fruit juices, as well as alcohol all contribute to high triglycerides. And so then, of course, lowering triglyceride levels can be done by minimizing those simple sugars and reducing alcohol intake. For HDL, we'd like to have a level higher than 1.2, and we can raise our HDL levels by increasing physical activity. So that's the main way. A goal of 150 minutes per week, or a goal that you've set with your team or your doctor or whoever you're working with on your health goals. Quitting smoking will raise HDL levels, and then eating more of those good fats, so things like avocado, olive oil, and then medications will help to raise HDL as well. So let's chat about some of the cholesterol lowering medications, and there's really sort of less categories than there were for the antihypertensive, so this will move a little bit quicker. So the main family of medications used to treat high cholesterol is known as statins. So drugs like atorvastatin, simvastatin, rosuvastatin, the trade names of some of these drugs you might hear are Lipitor or Crestor. And these drugs help to prevent that plaque buildup along the arteries. And their effect has a slower onset, but it's quite powerful. And these medications are usually taken lifelong. And they are sometimes prescribed for people who have evidence of plaque buildup, even if their blood cholesterol levels are normal. So, your prescriber may decide that because you have other risk factors for cardiovascular disease, for instance, if you have diabetes, that you will benefit from a statin even if your cholesterol levels are normal. So, they are kind of cardiovascular protectants. They are dosed once daily. There's a range of doses, and they're preferably taken in the evening, so supper time or bedtime. And that's just because the way that they work is on a substance that is more active in the body at nighttime, and so they're more effective when taken at those times. Some side effects, GI upset. I'm sure there's a whole host of them, but these are kind of the most common ones. Are you hear of muscle soreness, cramping, and weakness? So sometimes people will say, I didn't tolerate that medication. It made my muscles really sore, and they stopped taking it. But sometimes those side effects are relieved by simply lowering the dose or trying a different statin. So that's a conversation to have with your prescriber. And statins can have interactions with other medications, and also important to avoid grapefruit or grapefruit juice. So, grapefruit and grapefruit juice, there's a substance that is in that fruit that can interact with medication. So, just important to keep that in mind. Another type that you see are cholesterol absorption inhibitors. So the only one that I see and that I could really find was ezetimibe is kind of the main one. And so this drug works by reducing the amount of cholesterol that's absorbed from the diet, and it helps as well to clear cholesterol from the blood. It's often prescribed with a statin. So if you've already been on a statin for some time and your cholesterol levels are still elevated or not at your target, then ezetimibe may be added. And I believe it's dosed once a day as well. So similar side effects, there is the addition of headache, dizziness, runny nose, sore throat, and sneezing. That's listed on Heart and Stroke as well. Fibrates is another medication. Sounds like fiber, and I do believe that these drugs work in the same way that increasing your dietary fiber works. So, example is fenofibrate. These medications help reduce triglyceride levels, so they don't work on the LDL and HDL as much. They more focus on triglycerides if those levels are high. Um, Sorry, I apologize. They do decrease LDL and increase HDL levels, but their main effect is on triglycerides. Fibrates are normally taken with meals. Resins, for example, cholestyramine, is the last type of medication that we'll chat about. Resins work by increasing bile production. So, bile is a substance formed in the body that uses cholesterol, and this is a normal process. So, resins work by increasing the amount of bile that's produced, which means it needs to use up more of the cholesterol, so there's less available for plaque deposits. And then the cholesterol is removed through the bowel via the bile. These medications are normally taken once or twice a day and with a meal. Cholestyramine comes in a powder form. However, other types of resins come in tablets. One thing to keep an eye out for, or to maybe talk to your pharmacist or prescriber about, is that you should avoid taking other medications within 4 hours of a resin. And this is because they can bind with other drugs and kind of reduce their effectiveness or increase their effectiveness in the body. And so, if you take a lot of medications in the morning, perhaps you can't take your resin with your breakfast, but maybe you could take it with your supper or your lunch or some other meal during the day. So, just something to keep in mind with resins. Just a few main points to take home here before I leave you with this. So we talked about how cholesterol levels refer to more than one thing. So they refer to LDL, HDL, and triglycerides, and that targets are individual, but we're aiming for low levels of LDL and triglycerides and high levels of HDL. So remember that physical activity and diet can really go a long way in improving cholesterol ratios, but that medical management is important to reduce cardiovascular risk while working on modifying diet and physical activity. But that they may be required lifelong, especially in people with other risk factors for cardiovascular disease. And then, as always, don't stop taking medications without consulting your prescriber, and ensure that all interactions are known before taking over the counter medications and herbal supplements, etc. And that is it for this presentation on cholesterol and cholesterol drugs. I hope that everyone maybe learned at least one thing that they didn't know before. And thank you for listening.